Four amazing stories. How about a few questions before we close our...
Yeah, for the whole panel, what do you need from the legislature? What are your top two things to make this program more effective?
What do you need from the legislature? Roger's listening. What about in areas of authority or probation versus rule?
Well, it's changing some of the legislation to allow probation to do some of the things that parole could do, like with the California County driver's license. I mean, that's a big one. When you are trying to coordinate with out-of-state birthplaces to get driver's license, to get birth certificates, so you can get license and ID, so you can help connect them to services. We really have to look at how long we classify offenders as offenders. And I say that particularly with the sex offender population, because you may have somebody who had a sex offense 30 years ago, and it really, on a scale of 1 to 10, was a 2 or 3, but they're bound by the registration laws, which make housing difficult. Some of the drug offenders who maybe have been clean for quite a while are prohibited from accessing housing, medical services, and we really need to start looking at how long do we punish or hold the person accountable before we say, okay, maybe there has been some change and maybe we need to remove some of those restrictions.
You know, for me, yeah, it is the money, but it's realignment across the board. When you look at 2011 realignment in total, you know, when it comes to the CCP, obviously I've been doing realignment since 1991, so I had a lot of experience on that front, and I understand both the pitfalls and the benefits. But 2011 realignment's a little bit different. You know, as I kind of toyed with the assemblyman here, that you know, state departments still have their hands in realignment and managing it. So, you know, I was at another forum once where they said it's like, you know, we got the house without the keys. And really, we got the house without the keys, and the state's renting out the rooms. You know, so take drug Medi-Cal, for example. That's a realigned program. It's a significant risk because it's an entitlement. But the state still manages, the State Department of Drug and Alcohol program still manages certain contracts within that program that the county has no control over. And so that makes it a very difficult thing to do. On the mental health side, the state is still managing how the money is allocated out to the counties. In fact, it's almost gotten to the point where you increase your need for money, you're almost guaranteed to get it, which realignment really should work. You get your cut of the share, you make it work for you. If you're successful, you generate a savings and you use that savings to do things differently at the county. And what's happening is a State Department meddles with that and moves the money around to make sure everybody's got their fair share, which actually becomes an incentive to spend more whether you're successful or not. So Prop 30 obviously propels us a step forward, and we still have a lot of other things that remain unfinished about you know, percentages of transfers between the accounts and that type of thing. So we got work to do with that in face of Phase 2 realignment, which when you really think about Phase 2 realignment is it's really, I know Lee's here in the audience, and Lee Kemper from CMFP, and I heard this from him, and I just think it's brilliant. It's not about whether the state is going to take realignment from the counties or not in Phase 2. It's an argument about how. Because on the health side, as things shift in healthcare reform, the state's going to want to come and take money back from us that they no longer think we need. And how do we manage that process so that it doesn't devastate the success that we're having up here in dealing with just this one population in comparison to so many others. So even though we're not even done with Phase 1, we've got an amazing opportunity and battle beginning to brew on Phase 2 that's really going to require a lot of attention from our county elected officials.
Other questions? I'll come back to John, but how about over here?
And this is probably more of a comment. Scotty, thank you for saying that. Because as I was listening to the Assemblyman use First Five as an example, in my county, my small rural county, we lost 32% of our funding with First Five. when school readiness was shifted. And the program that was put into place, we can't meet the match to even participate. So that is my concern when I'm watching what's happening with realignment, is that money is going to start shifting. We received $140,000 to put our program together. You know, really, in the big picture, it's chump change. And so that is my concern as they're still juggling balls around and where the money's going to go, that it's going to follow the way that First Five went for my rural county.
Bill, I just want to thank the panelists. It's really helpful to not go to a seminar that says this is how you do it. It's always nice to hear people say this is how we did it. And so that's very helpful. But Scott, I'm having a little trouble with something you said, and I need you to help me out. I've been to Glenn County. I have relations in Glenn County. I'm from an urban county. Could you explain to me how a parolee finds a chainsaw on the side of the road? And why that's a good thing? I've just been sitting here just thinking too much about it.
Yeah, I know. And normally I would say we assumed she found the chainsaw on the side of the highway. And she did. She presented herself in the training program and said, "Look what I found on the side of the highway." And we actually did inspect it for a serial number to make sure it wasn't a lost or stolen item. And I understand that does sound a little bit concerning, but considering the type of conviction that this individual had, that wasn't really a concern, and it really became a question about, okay, now that you found something you get to keep, what can you do with it? And she started a woodcutting business, and she not only employs several people, she's actually bringing AB 109 participants into training, because our middle phase is, all right, come to work on time, learn how to wake up to that alarm clock, learn how to dress appropriately, learn how to fill out a time card, learn how to communicate to your employer. And so it was a leap of faith, absolutely no doubt. Better than an axe.
Good point. Other questions? Yes?
On workforce development, did any of you encounter barriers or obstacles to working with your workforce investment board or group? And if you did, though, how did you overcome it?
So how about working with the WIB?
Most of our work so far has been done through vocational rehabilitation services because they can draw down funding for mental health assistance to help these individuals. We are now partnering to bring in a job developer, which will come from the Workforce Investment Board. But so far there hasn't been obstacles. They've been ready and willing and able to do resume seminars, coaching and development, interview techniques, things like that at the helm. It's not something we've institutionalized, but at the clip they're ready to do it.
Yeah, I think that hits the nail on the head, because San Mateo also mentioned about folks using the expertise. So that and so our WIP program does the cultivating of the placements for private business in the community, which has also resulted in the fact that the county picks up workman's compensation and covers the liability initially. That was the deal we had to make with the private sector to make the program work. The other thing we never had an opportunity to mention up here today is we also use the WIB to work with the County Office of Education, and they've actually established a charter school specific to the AB 109 program for completing your high school diploma. And that program is still rolling out, but it allows Office of Education to access career technical education dollars from the federal government when they enter into an agreement with their local WIB, Workforce Investment Act folks, to include WIA participants in the school. And so it's modeled after what's called the John Muir program.
If each of you could add one new program to your sort of inventory, what would it be?
So if they could add one new program, what would it be?
I was actually having a conversation before we started this. I'm already trying to get these ideas from the other award winners here and implement it and make a super program, I can say. Because, I mean, if there's good work out there, just put it all together and, get success.
Pedro, of what you've heard, which one really jumps out at you?
The probation's actually taking really the empowerment and being part of the solution. Changing their mindset. That really jumps out at me.
Others?
Adding trauma-informed care, I think that's very important in a welcoming environment. BHRS, we actually have a welcoming policy, and you would think that all our departments are very welcoming, but in practice, we close sometimes for lunch and those kind of things, and we expect people to see us when limited availability, and we don't do like a Kaiser model kind of calling people and reminding people. We do that now, but I think those little things, that welcoming environment, and really kind of institutionalizing that, as well as trauma-informed care.
I think what we're moving towards in our next step in this is going to be going away from the 8 to 5 model. We're going to be doing evening classes, evening services, and we're going to be opening on the weekends. And I think that is a big thing to provide the services when the clients can access them.
The one thing we talked about that we never did, kind of following up on the San Benito approach, is when we were kind of brainstorming things to do, we wanted to match an AB 109 participant with each public official in the community, and actually have the public officials be the mentors, because we were trying to change the mindset on how we view reincarceration and incarcerated folks. But at the same time, doing things like having the two go and read to the elderly and that type of thing. So, kind of the San Benito model, but including all of our public officials in that.
Brent, what's on your wish list?
I really like the day reporting centers for the night and weekends. I think that it would be huge for a lot of counties. But we're a small county. We're not there yet, but I think it's a definitely wish list.
Yes.
Veronica, you mentioned that as you were integrating services for the client population, that confidentiality issues were kind of a challenge. I know that on the alcohol and drug side, there's some very stringent federal confidentiality rules. Do you have any problems getting clients to sign release of information or?
We haven't come across that. Our biggest hurdle was communicating with each other. And so we would meet, and that was, because probation has a whole plethora of information that we would love to have, but we can't get it. So what we did, though, was we worked on that and developed an MOU so that we could access each other's communication. The client information wasn't as difficult to us to get past, and I think that's because, too, we have an AOD counselor who's present with a mental health person, so they understand that and then are able to articulate that to the other folks who are present. So we haven't had anything like that, but what we did, an interesting thing that's not really related, but kind of, is that when we get the information from the prisons, when we got the packets, and we looked at the compass to see what information's on there, which is really interesting, but for the mental health and drug and alcohol side, it means nothing to us because it's all in code and we don't know what that stuff means. We were able to ascertain some things about who's coming out, how many were women, and how many were older people, and how many were people of color. That kind of communication helped us. We also, though, were able to run those names within our own database to see how many of the folks coming out are known to us. And about 80% have had open cases with us in mental health and substance use. I mean, that's an astronomical number. But so they're familiar with us, and what we found is that they're pretty trusting of us because they already know us. They've already received our services prior to getting incarcerated, and they're willing to give another chance.
Yes.
5 years from now, we're going to try to figure out what it is that you've done that's been the most successful in one of the areas that we thought were going to be successful but didn't work out quite well. You're going to want to have some kind of data. You're going to want to have some information systems to inform your next level of decision making. How comfortable are you that you're collecting the information that you're going to need to be able to make those decisions 5 years from now?
So the question is, what kind of data collection systems are in place so 5 years from now when we're sitting around the room, we know what we've done?
That's really a good question. We just implemented a new case management system that is really helping us with all kinds of data. The state requires data, and so we developed it to track that stuff. We're really interested in tracking the offender's family, because it's really easily to do that in our county. Right now, it's usually they're training their children to, you know, go along their pathway, and so we've dealt with, you know, the mother and father, and now the kids. So that's something that we really want to look at, is to see if some of these programs are really changing some of these kids.
When I talked about information sharing, that's one of the issues we're having. And I think each department can produce data, but it's what can DBH drill down that we can, as probation, can drill down to really see. Is it what's effective with this person and not effective with that person? And it's getting past some of those confidentiality issues, because we can all share generic information, but when we start drilling down to client-specific information and each service they've accessed, it gets a little complicated.
Our CCP inside of our local implementation plan codified performance measures and outcome-based measures that we would want to see and that each department is reporting on. A collective tool which we all input our data into, we don't have that yet. Everybody, some people have really complex systems which we're using, while others use draconian Excel charts to just try and track something. So that is one of our strategies to develop a tool which we can do that, but we do at least have what we want to track, but how we track it collectively hasn't happened yet.
Yeah, and I would say we're in the exact same place. We know what we want to track, and we learned two things off the bat, was that our referrals between all of the different agencies wasn't happening hard or electronically, it was happening verbally, and that kind of first drew our attention to the sharing of information issue. And then just doing these presentations, because people ask so many questions about, well, you know, okay, you talked about the first 10, now what's happening with the next 27? So that just being here and doing these presentations really drives us to dig a little bit deeper in the data and follow it more closely, so I appreciate that.
Your question was really the focus of the a conference earlier this month I mentioned on realignment, and I think that's part of what all the counties, all the CCPs are working on, is how do we start measuring this data. And as you know, CSAC is in a partnership with the Sheriff's Association, Chief Probation Officers Association, to do additional training and data development systems, and so I think that's going to be something that everybody's acknowledged we need to have. I think we have time for one more question I saw somewhere. You're just swatting flies. Yes?
If not, I'll ask a second. What lessons have we learned from AB 109 that could we apply to the juvenile population to keep them from becoming adult offenders?
So Marty's question is, what about the juvenile population? What have we learned? Keep them from reoffending.
Or becoming adult offenders.
I'll answer that. I think we need to continue to use the evidence-based practices. A lot of times we use programs that just feel good, and we think, you know, it's great, but it really is not working. Like your Scared Straight programs, that absolutely did not work at all. So I think it's going back to really, you know, the statisticians telling us, hey, this is working, this isn't working, and I think that's what we really need to focus on, in using like risk assessments, separating the high risk with the low risk, you know, using that information that we know that works.
And we're actually in the process of doing, we call it mini crew for the juvenile hall. Basically same program, but the prevention piece of it, and really going back to, you know, get them away from their bad friends and put them in a better environment and really increase the education piece.
Yeah, and I would just add to that, I think overall, for me, the lesson learned is valuing folks, that folks need to feel valued, whether it's sitting around at the dinner table or reading to their children, and the result that comes from that is critically amazing. And then doing things upstream. We have a tendency to pull people from the waterfall, but not actually find out why they're jumping in the river to begin with. So one of the things we've done through First Five is we do a behavioral health assessment on every child by the time they reach the 3rd grade, and deal with it then.
Well, the 4 stories here were just 4. You all have your stories too that I think demonstrate what Assemblymember Dickinson talked about at the beginning, which is the innovation and creativity of counties to take these kinds of challenges like the realignment and turn them into innovations that go a long way to reduce recidivism, but more importantly, to improve lives in the counties, to improve communities and families, and make our communities safer. And I want to thank the panel today for sharing their stories and for you to participate in it.